Hey everyone, and welcome to this explainer. Today, we're heading straight to the heart of Northeast India to witness a truly remarkable story of medical innovation. We're going to look at how a seemingly small humanitarian initiative completely transformed into a lifeline for an entire region, tackling some severe, absolutely daunting medical challenges against incredible odds. Okay, let's dive into this. I want you to picture a region where access to specialized medical care is, well, incredibly scarce. A place where tricky geography, conflict, and economic hardship combine to create massive barriers to healing. So, what happens when world class reconstructive surgery is introduced into that exact setting? As you'll see, it sparks a real hero's journey. And it's not just for the doctors, but for the countless patients whose lives are about to be forever changed. Section 1. A healing hub in Nagaland. To really grasp the scale of what's happening at the Christian Institute of Health Sciences and Research, or CIHSR, over in Dimapur, Nagaland, we first need to completely redefine the term plastic surgery. I mean, when most of us hear that, we immediately think of vanity or purely cosmetic tweaks, right? But scratch that for our purposes today. In this context, aesthetic reconstructive surgery is all about profound, life-changing functional repair. We are talking about fixing severe cleft palates so a child can finally eat and speak. We're talking about repairing complex hand tendon injuries so a worker can get back to their job, or doing major oncoplastic reconstructions after devastating cancer surgeries. It is quite literally about restoring a person's life and dignity.
And this incredible initiative didn't kick off as some massive, heavily funded mega institution. No way. It actually started as a small humanitarian faith venture operating out of a modular operating theater. A senior plastic surgeon arrived at CIHSR just to study the feasibility of opening a plastic surgery department. Relying mostly on word of mouth and patients actually sharing their stories on social media, this tiny clinic started taking on incredibly complex cases.
And this brilliantly illustrates the sheer speed of their progress. It's honestly warp speed. Over barely 2 years, they went from that basic feasibility study in April 2023 to launching a dedicated cleft service called Happy Smiles. By early 2024, they were successfully audited by the global charity SmileTrain NYC. And by late 2024, they were performing complex surgeries not just for locals, but for refugees fleeing conflict across the Myanmar border. What started as a humanitarian response is now a teaching department. Moving on to Section 2, Bridging the Equity Divide. The bulk of the work involves repairing hand tendon injuries, which is absolutely crucial in an area heavily reliant on manual labor, alongside cleft lip and palate repairs and facial oncoplastic surgeries for cancer patients. And here's the thing, they aren't just treating patients from Dimapur. They are pulling in complex cases from the hill areas of Manipur, Assam, and right up to the international borders, massively impacting regional healthcare equity. Section 3. The Power of Global Mentorship. Now, this quote really stands out to me. This is direct advice from Professor John Mulliken of Boston, a literal Harvard expert, and a lifetime mentor. Imagine being a surgeon in Nagaland, staring down a highly complex facial deformity, and getting highly specific, real-time tactical advice like, avoid butt-to-butt closure and any Z-plasty, use a lower vermilion flap. It bridges the gap between a leading global institution and a semi-urban Indian hospital in real time. Simply amazing. Now, what's really interesting about this is how tangible the results of that virtual mentorship actually are. Take this 6-month-old child who came in with a rare Tessier 7 lateral cleft. Through virtual guided surgery directed by that specific advice from their mentors, the local surgical team achieved an incredible reconstruction. It's just a perfect synthesis of local skill and global knowledge.
And that leads us to Section 4, Transforming Patient Lives.
Because behind all the surgical techniques and international webinars, we're talking about real human beings. Let's look at the tangible impact on patient lives. Take the story of Najuna. She's an 11-year-old stateless girl who came to the clinic. At an age where social interaction is literally everything, she was living with a severe cleft. The team performed a complex repair, carefully managing the soft tissue to ensure proper future facial growth. And because of this intervention, Najuna is now confidently attending grade 1 at a local school. Surgery didn't just fix a physical gap, it gave her a social identity. And for procedures like a cleft palate repair using specialized suturing techniques, we really have to realize this isn't just about aesthetics.
Closing that cleft effectively at a young age is absolutely crucial for preventing deficient maxillary growth. It ensures the child can speak properly and eat without complications. It fundamentally alters the entire trajectory of their physical development.
But it isn't only children. Get this. The team was approached by a robust 104-year-old man. He had cardiomegaly, an enlarged heart, and excess eyelid skin that was literally blinding him and causing painful ingrown eyelashes. Despite the immense risks of operating on someone over a century-old, the team carefully performed a precise eyelid blepharoplasty under local anesthesia with constant monitoring. He recovered perfectly, simply thrilled that he could see clearly again.
We're also seeing vital interventions in cancer care. A patient suffered from recurrent basal cell carcinoma, skin cancer, on her nose. Now, excisional surgery leaves a massive defect, so the CIHSR team designed an innovative, tailored forehead flap, borrowing skin from the forehead to perfectly reconstruct the nose. It's a complete cure of an advanced cancer deformity, happening right there in Dimapur.
The program is also a lifesaver for occupational trauma. Take this 40-year-old manual worker who suffered severe electrical burns to his scalp, leaving necrotic exposed bone. Using an innovative modified yin-yang flap design, the surgeon successfully covered the massive defect, allowing the wound to heal and the worker to eventually reclaim his livelihood. Perhaps one of the most gripping cases involved a 2-year-old refugee child brought in from the war-torn Myanmar border. He had a massive, highly dangerous venous malformation. Open surgery just wasn't the answer here. Instead, the Reconstructive team partnered with their pediatric intensivist to perform ultrasound-guided sclerotherapy, injecting a specific medication directly into the lesion. Within 6 weeks, the malformation had almost entirely regressed, a cross-border toddler saved by an advanced, minimally invasive technique. Let's move to our final section and see how this builds the future of healthcare equity. So, what is the lasting legacy of the CIHSR program? The future is focused squarely on institutionalizing this success. They are working on rigidly standardizing safe clinical practices to ensure the care remains world-class. They're actively seeking solutions to overcome any remaining financial constraints so that literally no referral patient is turned away due to extreme poverty. And they're actually expanding their physical footprint, building a new, dedicated facility to house their growing partnership with Smile Train NYC. And that leaves us with a really profound final thought. We've seen how a single hospital, armed with dedicated local surgeons, transformative government insurance schemes, and an incredible network of world-class virtual mentors, can totally revolutionize healthcare equity in a challenging region. It begs the question, how can we replicate this exact localized, globally mentored model in other under-resourced regions around the globe? I mean, if it can be done in Nagaland, where else can we bring world-class healing? Thank you so much for exploring this remarkable journey with me. Catch you next time.